All right. Welcome, Epidemics. We're getting down to the very end of the semester now. So, want to remind you guys, assignments that are due very soon. So, the project is due on Sunday, April 30th. All presentations have to be done next Tuesday on May 2nd. So if you're planning to do a presentation, that's the day you'll be doing it. There will be a last set of assignments. I'm actually going to make some changes to the last assignment. Instead of having an essay, I'm going to have something else for you guys to do. But those are going to get posted on Friday, and those are going to be due May 7th, which is the following Sunday. Wait, no, Friday. Yeah, that'll be a week from Friday. So the last topic I have on the agenda is kind of a going over COVID and going over what can happen after you get a severe infection. So I'm going to start with the state of COVID today. And this is getting more and more difficult to describe because, for example, the United States is no longer recording or reporting COVID cases or COVID deaths. So a lot of the data that I'm going to give you today on the current state of COVID is either based on data from other countries who are still recording and reporting data, or an estimate, or a combination of the two. Right now, the number of new cases of COVID is at a low point. So we're not having nearly as many new infections. Cumulatively, approximately 1 out of every 3 Americans in the US has reported having at least one case of COVID. Now, this doesn't include people who test positive at home, and then, you don't tell your doctor, you don't tell the government, you're not getting an official test. Nobody knows that. So I'm sure that the percentage of people who've had COVID at least once is much, much higher than that. I was asking around friends and family and coworkers, and almost everybody I asked has had COVID at least once. I found one person who has not had it at all. So that should tell you something right there. I think it's much more common than the data that we have reports. Now, the trend in a lot of places around the world is an increase. It's just starting, but it's going up relatively rapidly. Notably, India, China, Brazil, and some parts of Northern Africa around the Mediterranean are having massive increases right now. These are very populated areas. Just because it's starting there doesn't mean it's going to stay there. We're also seeing a new strain, a strain called XBB 1.5. And when we look at the new cases that are being sequenced, 70% of those are this XBB strain. So it's a new strain coming around. What's going to happen? Are we going to see a peak in the US? We can't predict that, unfortunately. Just like we can't really predict how this pandemic is going to end. we've seen pandemics before. We've seen them end because of improved sanitation. We've seen them end because of just enough immunity in the populace. We've seen them end because of vaccination. Most of the time, they eventually kind of taper off. Some of these diseases that start out in a pandemic or epidemic will gradually just become, something that happens at a low background level. We see it with, well, the flu is kind of unusual because it changes every year, but we see a lot of things like rhinovirus. Rhinovirus is a virus that is endemic, and every year we see infections in people. Most people don't know they've had a rhinovirus. Rhinovirus is one of hundreds of viruses that can cause the common cold. So, things like that. And rotavirus is another endemic virus, causes stomach problems and diarrhea. Most of us have gotten it at some point in our lives, usually as children. And it just, you get it, you get over it, you go on with your life. We're going to have to wait and see what we're going to have with COVID. Mortality rate. Again, this is very hard to get accurate data about. One of the best ways to determine mortality is to look not so much at reported COVID deaths, but at what we call excess deaths. So we calculate excess deaths by looking at total reported deaths, not paying attention to the cause, and we subtract the predicted number of deaths. So, for example, in the US, we would look at the 5 years before COVID arrived, so 2014 through 2019, and we can use that data to get an accurate prediction of how many deaths to expect over the next few years, over 2020, 21, 22. And then what we do, that's our predicted deaths. So we look at actual deaths minus predicted deaths, and we get excess deaths. And that's a good estimate for deaths due to COVID, because we don't see any other major impact on deaths in the US right now. So we're not seeing another pandemic or something strange going on that would increase deaths, or a major advance that would decrease deaths. In the US, there have been 13% more deaths than expected since 2020. So that's a cumulative number. And when we look at the values there, that estimates that 1 out of every 300 Americans has died of COVID. That's a lot. 1 out of every 300. The good news is the case fatality rate is going down. So the number of people who get sick with COVID and then die is declining. A lot of that is because of vaccination. Vaccination makes you significantly more likely to survive. And we now know how to treat people with COVID. At the beginning of the pandemic, we didn't know which treatments would work the best. And so people were trying lots of different things and not necessarily having success. But we now have better understanding of exactly how to treat people in order to save their lives. Currently, when we look at causes of deaths in the US, COVID is the number 3 cause of death. Number 1 is cardiovascular disease, so heart attacks. Number 2 is cancers. And number 3 is COVID. That is by far the highest that we're going to see an infectious disease on this list. I mean, it's really up there as major cause of death. It is both in the US and worldwide currently the deadliest infectious disease going on around there. Tuberculosis is number 2. And so tuberculosis is something we have not talked about. We're going to talk a little bit about it before the semester ends because tuberculosis is on the rise. There are over 1 million deaths per year from TB. This is making it a significant disease in the world. Even worse, a lot of these cases are turning out to be drug-resistant tuberculosis. So this is something that we should be watching for the future. It's coming back with a vengeance, and it could be nasty. So when we look at other diseases, this list is a list of other diseases that are currently in epidemic or pandemic states and diseases that we are watching closely and trying to make sure that they don't become major problems. So we are currently having epidemics of the first, well, yeah, we're going to call the first 3. These are serious pandemics that are occurring right now, besides COVID. So TB, cholera. Cholera has been in a pandemic state for over 100 years now. Have you heard of cholera? Do you know about the cholera epidemic? Probably not. You probably don't know about the TB epidemic, and it's a major one. Cholera, last count, there were 3 million cases of cholera in close to 50 different countries around the world. Most of the problem is in impoverished countries that have poor sanitation standards and do not have good access to clean water. So cholera is carried in the water, usually from bodily waste getting into the water supply. And then the cholera gets in there with the bodily waste and infects people. And cholera is a nasty disease, and it does have a relatively high mortality rate. HIV/AIDS is still ongoing. We're a little more aware of that one, but we do have treatments that can help reduce the impact of HIV in the world today. But again, the people with access to those drugs are largely in the wealthy countries. So again, we're seeing impacts more in impoverished countries. You may have heard about monkeypox. Monkeypox is a pox virus, like smallpox, like cowpox, but it's not nearly as transmissible as the others. Certainly not as transmissible as smallpox, and with a much lower fatality rate. So it is something to keep an eye out for, but vaccines are available for that one. And it doesn't seem to have gotten firmly established at this point. There have been waves of monkeypox outbreaks in the past, and hopefully this will be just another wave of outbreaks. Marburg virus. So right now, Marburg is in outbreak condition in 2 countries in Africa, Equatorial Guinea and Tanzania. They're not very close to each other. It's like saying there's an outbreak in Massachusetts and Colorado. That's really far away from each other. So probably got transported probably from Equatorial Guinea to Tanzania by tourists or travelers. Marburg is a viral hemorrhagic fever. It's kind of like Ebola, but it doesn't have outbreaks as frequently and doesn't tend to cause as many deaths when there is an outbreak. Right now, we are in the third largest Marburg outbreak ever, which isn't saying much because the two outbreaks higher than that still only had death tolls in the low 100s. So it's out there, it's going on, but it's probably not going to be a big thing, just like Ebola. Ebola is relatively easy to contain, and it doesn't tend to spread long distances. So while we're having that epidemic, we're not really worried about it. Polio is not considered an epidemic. This is a disease that's been around for a long, long time and has become endemic. Or did become endemic. So it was something that most people would get in childhood or get, well, not most people would, okay. So most people would get it. It doesn't always cause symptoms. People were afraid of it because if it does hit you hard, it causes paralysis. And it's something that was very visible in the community. You would see children that were healthy and then became paralyzed. Before COVID in 2019, there were 2 places in the world you could find polio, naturally occurring polio, and that was Afghanistan and Pakistan. Unfortunately, COVID came along and really messed things up. We were working really hard trying to eradicate polio. Very hard to do that in Afghanistan and Pakistan. But cases were on the decline. Unfortunately, since COVID came along, there have been new reports of polio in multiple different countries that had previously been declared polio-free. So we had it contained to that little part of the world, and now it's broken out. In an ideal world, we would be able to corral it again and eradicate it again from these countries. But COVID has screwed up so many things around the world, and there's just not as much ability to organize and fund these sorts of activities right now. So it's an issue. So that's kind of the state of COVID and the state of other epidemics and pandemics going on right now. Do you guys have any questions on those? All right. Then I want to talk about long COVID. So long COVID is what we call a post-infection syndrome or a post-acute infection syndrome. These are a collection of disorders that occur after a person has cleared an infection. So you get an infection with COVID, you get over the COVID. Cleared means you don't have an active infection going on. And then you get other symptoms and you get these other kinds of conditions that can show up after an acute infection. Now, it's tricky because there's not a nice, easy test that you can do and say, oh, yes, you no longer have any COVID virus in your system. Well, we can't test your entire body for a few virus particles. And if the virus is in a dormant or latent state where it's not actively reproducing or actively causing an infection, that's an undetectable infection. What we do see is post-infection syndromes occur in people who do not have an active infection. So long COVID occurs in people who test negative for COVID. And we're talking about it because of long COVID, but these types of post-infection syndromes can happen after a lot of different diseases. I'm sure you've heard of problems with long-term or post-Lyme disease, where you get Lyme disease and then you have chronic conditions afterwards. We can also talk about myalgic encephalomyelitis, that's a mouthful, or chronic fatigue syndrome. I'm going to call it chronic fatigue syndrome. These are a collection of symptoms that show up with each other pretty consistently, and they come after infections. Sometimes months, sometimes you don't know what the exact cause is, what triggered it. Regardless, these post-infection syndromes have impacted millions of Americans. It is a major cause of disability. Women are more susceptible to these conditions than men. Just like women are more likely to get autoimmune conditions than men. Female immune systems are, we think that the reason for this has to do with the fact that women can get pregnant and you have to worry about immune function and not attacking the fetus. And there's this really complex coordination between the tissues in the placenta that were created by the fetus and the mother's immune system, where the fetal tissues are trying to damp down the mother's immune system, but the mother's immune system has to be strong enough that she doesn't get deadly ill. And so women tend to have a more active and robust immune system when they're not pregnant. But that means that they can, get a little overexcited and cause these autoimmune conditions. I'm not saying post-infection syndromes are completely autoimmune, but they seem to happen more in women, and that's probably something going on there with the immune system. There's a long history of patients not being believed with these syndromes. When chronic fatigue first became a term that people talked about, we were mostly seeing it in women, and patients would often be told, oh, it's all in your head. It's just depression. Go to therapy, get over it. It's not all in your head, and it's not due to depression. Now that we've seen long COVID showing up so frequently in people, there's a lot more acceptance to these conditions, and we're starting to see increased research and increased funding for them. All of these post-infection syndromes are long-lasting. So they will last months or years, or in some cases for the rest of the person's life. We don't know what can cause these differences and how long they last. We just simply don't have the information there. We know that people who have their symptoms decline or get better can have a resurgence in symptoms. So you can have periods of time where you're not feeling as bad, and then you have a recurrence. So it's a very, very complicated syndromes, a collection of diseases. Syndrome, that term by itself, has certain implications, and it implies or refers to a group of symptoms that tend to occur together. So you tend to see the same symptoms in patients over and over and over again. Now, that doesn't mean that we know the cause, and it doesn't even mean that there's only one cause. So chronic fatigue, for example, we're starting to transition from considering that a disease and more a collection of symptoms with multiple different causes. Certainly, people with long COVID fit the definition of chronic fatigue syndrome. Some of them do, not all of them. So that's one of the reasons we're saying, it's not necessarily that chronic fatigue is a single disease, but that it's multiple diseases with the same symptoms. The term syndrome can often stick even after a disease is figured out. So Down syndrome, which is a genetic condition, we know what causes it now, but we still call it syndrome because the name got so well known, even though it's not technically a syndrome anymore. I hope that's clear to you guys. Now I've got 3 other diseases listed at the bottom here. And I want to mention these because all 3 of these can have long-term health impacts after the infection. And these impacts are not post-infection syndromes like we're going to really be focusing on today. Measles can result in a loss of the acquired immunity. So it can destroy your immune system's memory. And it weakens the immune system for 1 to 2 years. So we don't have a lot of measles in the US right now. It is still a disease that occurs. It is still a nasty disease. It's a bad infection, or it can cause a bad infection. It can cause a lot of things like neurological damage, deafness, death. But patients who recover are still more likely to die in the 1 to 2 years after infection than the same age and socioeconomic status children who did not get measles. And that's because this weakened immune system. Human papillomavirus may or may not be cleared. It's a virus that tends to be able to go into a dormant or latent state and not cause problems. And in fact, most HPVs get cleared, some of them don't. But regardless, this is best known for being tied to cancers. We think about it with cervical cancer, but we also get penile, anal, oral, and throat cancers. And several other cancers, uterine cancer, vulvar cancer, well, I don't think testicular cancer, but it can cause all of these different types of cancers. And HPV, you may not even know it if you got it. If you aren't vaccinated, you probably got it if you're sexually active. Epstein-Barr virus. This is the virus that causes mononucleosis, or mono. Mono is a common disease among college-age students, causes a lot of fatigue, debilitating fatigue, and some cold symptoms. But after recovery, this seems to act as a trigger, and this can happen years later, guys. It can be a trigger for autoimmunity that attacks the nervous system, specifically multiple sclerosis. So we've figured out that a major cause of multiple sclerosis is that a person has been infected with the Epstein-Barr virus. The virus has gone dormant and has somehow triggered this autoimmunity. So as we go through, we're really going to be talking about long COVID and chronic fatigue kind of intertwined, because we know more about chronic fatigue. We've been studying it for longer, and it's very, very similar to what we see in long COVID. So these post-infection syndromes tend to have a lot of the same symptoms. Fatigue. Fatigue is not just feeling tired, it can be absolutely debilitating. And in these, especially with chronic fatigue, these post-infection syndromes, that fatigue gets worse with activity. So a lot of times, if people are tired a lot, you get told to exercise more because it helps build up your stamina. It doesn't work with these post-infection syndromes. Exercising actually makes them worse. And it doesn't even have to be exercise. A lot of people will get tired just doing everyday activities. We see neurological impairments. So insomnia, which is sleep problems. This can be problems falling asleep or problems staying asleep. Increase in depression and anxiety, irritability, but also things like what's called brain fog, which is difficulty with memory, concentration, decision-making, and those sorts of things. We also tend to see, that would be over here with neurologic. In long COVID, we see loss of sense of smell or sense of taste in some long COVID patients. Even if they didn't lose their sense of smell during COVID, it can be lost later. Headaches, tinnitus, which is a noise in your ears that it's not caused by anything. It's not an external sound, but you detect it and you hear it constantly. We can see pain in the joints or muscles. these symptoms, we can also see symptoms that occur in other systems in the body, like the cardiovascular system, the heart and the blood vessels, the respiratory system, including long-term cough, damage to the lungs, the gastrointestinal system. Lots and lots of different problems can show up there. Each person is going to have their own unique collection of these symptoms. The underlying things that tend to occur in most patients with post-infection syndromes are the brain fog, the fatigue, and the pain. Most of the pathogens that cause this are viral pathogens. So there's post-COVID or long COVID, post-Ebola, post-dengue, post-polio, post-chikungunya, post-West Nile. There's a whole bunch of diseases that only occur in Australia that can also cause this. Q fever is one. But these can also show up after Lyme disease, which is bacterial. These can also show up after Giardia, which is a parasite that infects the digestive tract. So there are lots and lots of different diseases that can cause these post-infection syndromes. So this is specifically a list of conditions that we see with long COVID. It came out of a paper, I think it was published October of 22. And so a lot of the things we see are things that we were talking about before in the previous slide. What we tend to see that's unique to long COVID is loss of smell and or taste, the microclotting. So lots and lots of little tiny clots in blood vessels. Development of type 2 diabetes, which is not something that we tend to see with most other viral infections. Impacts on the reproductive system. These impacts can include changes in the menstrual cycle for women, reduced fertility for both men and women, increased risk of endometriosis and early menopause in women. Endometriosis is a very painful condition where you have the tissue that normally grows in the uterus, the endometrium. Okay, so during a woman's fertile years, we know once a month she has a period. What is being gotten rid of during a period is a lining of the uterus. So every month during the woman's fertile years, she grows a lining on the inside of the uterus. And this lining is preparation for attachment of a fertilized egg and pregnancy. If the woman does not get pregnant, she sheds that tissue. Endometriosis occurs when that type of tissue that normally grows inside the uterus grows in other parts of the abdominal cavity. And so it can be incredibly painful, especially during certain times of the woman's hormonal cycles. So that's something that the risk goes up after COVID. Men, erectile dysfunction, big problem after COVID or with long COVID. Reduced sperm count, reduced semen quality, reduced semen volume. So we're really talking about lots and lots of changes that result in reduced fertility. Changes to the microbiome. So the microbiome, we have talked about what that is, and we see changes in this. We can see changes to specific bacterial populations. So we can look at certain populations and see that they've increased and different populations have decreased. Now, the microbiome is incredibly complicated, and we don't necessarily know what these individual species of bacteria are doing. But when we see these changes, we also see an increase for things like inflammatory bowel disease, Crohn's disease, and other serious digestive impacts. We see an increase in autoimmune disease. A series of recent reports, so there were 3 reports published late 22 and early this year that have all shown high levels of antibodies, what we call autoantibodies, in patients with COVID, long COVID. These are antibodies that will attack your tissues. So that's increasing the risk for rheumatoid arthritis, psoriasis, type 1 diabetes. Okay, I've been giving you long lists of all of these symptoms because there's a hell of a lot of symptoms. So how often does long COVID happen? Well, it varies in different populations, but between 1 out of 10 and 1 out of 3 people with COVID will have some degree of long COVID. The highest rates are in people who had to be hospitalized for COVID. So the more severe illnesses. The lowest rates are in people who were vaccinated. So people who were hospitalized, up to 70% of them will develop long COVID. People who are vaccinated, it's more like 10%. Once again, these are estimates because we know that COVID has been strongly underreported. And we suspect the same thing is true for long COVID. So what causes this? Okay. If I knew the answer to that, I'd be going and getting a PhD in COVID, but we don't know yet. We do see changes to the immune system. Again, the changes are not just like more cells or fewer cells. Some types are more common, some are less common, but there's basically dysregulation. And these changes are found for at least a year after infection. So something's going wrong with the immune system. We know that. There is the pathogen reservoir concept, or also known as reactivated virus. This is where this usually happens in viruses that have been dormant. And a lot of the viruses that can be dormant are those in the herpes virus family. Now, I know we all know about the sexually transmitted infection herpes virus, but there are lots of other herpes viruses, things that are related, like Epstein-Barr virus, which causes mono. Chickenpox is a herpes virus. And these things can remain dormant in your tissues for years or decades. More than 90% of adults have been infected with at least one herpes virus. And of those who've been infected, almost all of them still have dormant herpes virus in their tissues. We like to say that herpes viruses are forever. Almost nobody completely clears the virus from their system. These viruses remain in that dormant state. You get old, your immune system isn't working as well, or you get sick with something else and they can reactivate. Reactivation means they start multiplying and causing infection again. And we know that Epstein-Barr virus reactivation is associated with chronic fatigue syndrome. So we know that that particular one is implicated in these post-infection syndromes. We can see damage to endothelial cells. Endothelial cells are a type of cell that lines the inside of things like blood vessels, your lungs, your digestive tract. This damage to those cells is probably one of the things that causes those microclots. Clots form when cells are damaged, especially these endothelial cells that line the blood vessels. This causes the platelets to make a change. They recognize that there's damaged tissue and they start forming a clot. We know that up to 60% of patients with long COVID still have viral proteins. These viral proteins are persisting after the infection. So, not quite sure what's going on here, why these proteins are able to stick around, but they have been found in lots of different tissues in the body, and especially in the brain. So with long COVID or post-COVID, we do tend to find the spike protein specifically in various parts of the brain and the supporting tissue. The spike protein is the part of the virus that our immune system attacks. So here we go again, we're bringing the immune system back in. If we've got spike protein, we may very well get an immune response. And of course, long-term tissue damage. This long-term tissue damage occurs, we're looking at people a year after having gotten COVID. At least 70% of patients who've been looked at show signs of some kind of damage to their cardiovascular system, their heart and their blood vessels. But we also see damage to the lungs, the kidneys, the pancreas, the spleen, all of these different internal organs. Again, 1 year out, at least 60% of people show damage to one organ, and 27% show damage to multiple organs. That's a lot of damage a year out after infection. We see changes in hormone levels in long COVID. Specifically, we have low levels of cortisol. Now, cortisol is thought of as the stress hormone, and it certainly does go up when people are stressed. But that's not its only job, and we have to have some cortisol in our blood. It controls metabolism. It helps regulate the immune system. Here we go, immune system dysfunction again. Cortisol has a role in regulating blood pressure, the sleep-wake cycle, blood sugar. And my cat's biting me. Let go of my hand. If you don't want me to pet you, let go of my hand. Let go, let go, let go. Sorry. There's a really complex system that helps regulate levels of cortisol. We call regulating anything in the body homeostasis. This is maintaining a relatively steady level. So maintaining cortisol in a certain range, which is what we want for healthy life, the system that normally regulates that is also not working correctly. And so that can mess with hormones and other systems. So who is at risk? Anybody who gets COVID is at risk. We do see higher rates in people with other chronic medical conditions. Diabetes, autoimmune diseases, chronic fatigue. I saw a reference to a paper that was looking at a link between long COVID and attention deficit disorder. I didn't read that paper, but that's kind of an interesting one in my opinion. Long COVID is more common in women, I've mentioned that, but also people with Hispanic or Latino heritage. So there's got to be a genetic role in here. Maybe. We'll get to that in a second. Long COVID, and we're going to get to it right now. Long COVID is more common in people who are unable to take time off of work when they're sick. So the best thing to prevent long COVID, if you get COVID, is to take time off and rest. Rest during the infection and during the recovery period after the infection. Okay, I don't know about you, but who can afford to do that? Only the rich people can afford to do that with good health insurance and good numbers of sick days, right? So I said long COVID is more common in people with Hispanic and Latino heritage. In this country, unfortunately, that means people working lower paying jobs. So it might not be their heritage so much as their socioeconomic system or situation. Now, how do we diagnose somebody with long COVID? Okay. This is really a really challenging diagnosis. Symptoms may come and go. So you may have symptoms for a while and then not have them for a while and then have them again. So that's tricky. There is not a single test that can be done that can say, aha, this is the marker for long COVID. You have the marker for it. You have it. We can look at certain markers that are suggestive based on the symptoms that you have and based on what we know of chronic fatigue syndrome. But that's multiple tests and it's a little tricky and a little expensive. And frankly, most doctors that don't specialize in post-infection syndromes don't really know to give you these tests. They don't have the exposure to those patients and they don't know what to do with for those patients. The symptoms that you report, they're largely what we call self-reporting. You come in and you go, I am so fatigued. How does your doctor test that? They ask you questions, you're telling them, and they're having to trust that you're telling the truth. I've got pain. How do you detect that? They do those little smiley faces things where you're like, okay, so do you have a frowny face or a smiley face? You know, what number applies to your feeling? Well, that's going to be different between different people. I'm having trouble with my memory. Well, if you're not young, you might get told that happens with age. You know, or that happens with stress. You know, doctors don't always believe people because when there's not a test that they can do for the symptoms. Especially if you present as female, doctors are less likely to believe you. And if you have pigmented skin, they are less likely to believe you. And sometimes they'll go, well, you have fatigue and pain because you're depressed. Well, maybe it's the other way around. Maybe you're depressed because you have fatigue and pain. Frankly, if you've got fatigue and pain every day, it's a pretty good reason to be depressed, in my opinion. And treatments. There are actually some treatments, but most of them are going to target specific collections of symptoms. So there's not a treatment for long COVID. We don't know what's causing it. We have some hypotheses, some ideas, but we don't know for sure. So if you've got clotting, you can take a medication designed to reduce clotting, an anticoagulant. If you've got digestive problems, probiotics are helpful. Probiotics are not something you should take routinely, but if you have acute digestive problems or if you've taken antibiotics, then they are very useful. They're very useful with antibiotic use. You just have to make sure not to take them at the same time as the antibiotic. One of the things that shows up in patients with chronic fatigue is damage to the mitochondria. So you've probably heard that mitochondria are the powerhouse of the cell. I hate that phrase, but it's true. This is where most of the energy that your body needs to function is made. We take food from our diet, run it through the mitochondria, and that converts it into a form of energy that our cells can use. And for that one, coenzyme Q10 supplements can help. Coenzyme Q10 is what I studied in graduate school. This is the only situation where I've heard it recommended that I believe that it actually does anything. Because if you've got damage to your mitochondria are what make they make CoQ10, coenzyme Q10. And so if your mitochondria aren't working, you're not making enough coenzyme Q10. So supplementing with that can be helpful in cases where there are mitochondrial problems. So the best thing to do is prevention. Masking, improved air handling in public places. I was really hoping that we would recognize that this helps reduce infection with COVID and that, you know, schools and malls and stores and all of these public spaces would replace their old air handling systems, which frankly, you know, they often don't work very well, and put in new ones. Well, yeah, they're not doing a great job of that. And one of the best ways to tell is by monitoring levels of carbon dioxide. Because if the carbon dioxide is high in a room, that means the air handling is not working very well. Also, during the acute COVID, so when you actively have the infection, treatment with Paxlovid can reduce the risk by 25%. So that's pretty good. The bad news is that every time you get infected with COVID, you're at risk. And reinfections are disturbingly common with COVID. It appears, and this is not confirmed yet, this is a tentative result, that every additional infection, you are at an increased risk for long COVID. So the more times you get infected, the more likely you are to get long COVID. And of course, vaccination, it doesn't guarantee you're not getting COVID, but it significantly reduces the risk of long COVID. So I've got a couple of important notes here. There is widespread lack of information on these post-viral syndromes, including among medical personnel. This causes a big problem because when people do not get help from medical doctors, they often go towards unconventional treatments. And these unconventional treatments are often untested and unregulated. Some things might help, most things won't. And some of them can be seriously harmful and expensive. This is one of those things that I really, really hate in this country that drives me crazy. You can go to the drugstore, which is someplace you would think, you go there to get prescription medications. You would assume that everything there is helpful, and you can buy stuff off the shelf that's untested, unregulated, doesn't even necessarily have what it says on the label, and could be harmful. That drives me crazy. All right. Once again, I'm finishing up a little bit early here. I'm working on a lecture for Thursday to go over tuberculosis, since it is on the rise, which I actually did not know until recently, which is why it wasn't on the syllabus. I'm glad we have a little time to go over it. Are there any questions on today's material, though?
I actually have a question. So earlier you talked about Lyme disease, and I was wondering, I heard that there's a side effect of like the prolonged effect of Lyme disease where it's you can't eat meat. It's like a allergy to meat or something.
Okay, that's not Lyme disease, but that is a tick-borne problem. The tick is in the US. I'm not sure if it's in Massachusetts, but if it's not, it's coming. And yes, this particular tick species, if you get bitten by it, it does cause you to then become allergic to, I'm pretty sure it's just mammal meat. So chicken is okay. I'm pretty sure. But yeah, it does make it so that you can't eat beef anymore.
Crazy.
Yeah, it is. There are lots of weird things that are transmitted by ticks. There's also a tick-borne paralysis, where if you're bitten by the tick, you get paralyzed. And as soon as the tick is removed, the paralysis starts to lift. But somebody has to find the tick. I think that's an Australia-specific disease. Okay, if there are no other questions, I will see you guys next time to talk about tuberculosis.
Thank you very much.
Okay.
Thank you.
Bye.
All right, thank you.